Fluoroscopy. If you've just been scheduled for one, there's a good chance you've never heard that word before today. And if you looked it up and got more confused, you're not alone. This video is specifically for you. By the time it's done, you'll know exactly what fluoroscopy is, how it works, why your doctor ordered it, what the machine looks like, what to expect when you get there, and, yes, how radiation is managed safely. Let's start at the beginning. It is completely normal to feel a little unsettled when you're scheduled for something you don't fully understand. And if radiation is the first thing on your mind, that's a reasonable question. Radiation comes up a lot in medical imaging. We're going to address it honestly, with accurate information. Not to minimize it and not to frighten you, because the truth is actually quite reassuring when you understand it. Fluoroscopy is one of the most carefully managed imaging procedures in radiology, and the team performing yours is trained to do exactly that. Get the images your doctor needs while using radiation as responsibly as possible. So, what is fluoroscopy? The simplest way to think about it, a standard X-ray is like a photograph. It captures one still image of the inside of your body at one moment in time. Fluoroscopy is like a video camera. It uses X-ray energy to produce a moving, real-time image, showing anatomy in motion as it's actually happening. That's why your doctor ordered it. Sometimes a single still image isn't enough. Your doctor may need to watch how you swallow, or see how contrast material flows through part of your digestive system, or guide a needle to exactly the right place in your spine. For all of those things, a moving image, a live image, is the right tool. Fluoroscopy is that tool. Let's look at the equipment. There are two main types of fluoroscopy machines. The first is called a C-arm, named for its shape. It looks like a large letter C. On one end of the C is the X-ray tube, which generates the X-ray beam. On the other end is the detector, which receives the beam after it passes through your body. You're positioned between them. The C-arm can move and rotate, which makes it useful in operating rooms and procedure suites where the patient needs to stay still. The second type is a fluoroscopy tower, a fixed unit installed in a dedicated imaging room. It has an examination table you'll lie on, and the X-ray tube and detector are mounted above, below, or beside the table. Here's how the image is created, simplified. The X-ray tube produces a beam of X-ray energy. That beam travels through your body. Different tissues absorb different amounts of that energy. Bone absorbs more, so it shows up bright on the monitor. Air absorbs very little, so it appears dark. Soft tissues fall in between. The detector on the other side picks up the beam after it passes through you and converts that information into a live image on the monitor in the room. And because this happens continuously, or in rapid pulses, you get a moving image rather than a still photograph. A real-time window into what's happening inside. Now, about radiation. The X-ray beam in fluoroscopy is active for longer than in a standard X-ray because the team needs a moving image rather than a single shot. That's accurate. But here's what's equally important. The imaging team uses specific techniques to reduce the amount of radiation used while still getting the images your doctor needs. One technique is called pulsed fluoroscopy. Instead of a continuous beam, the X-ray fires in short bursts, reducing the total beam-on time. Another is last image hold. The machine captures and holds the most recent image on the monitor even after the beam is turned off, so the team can review it without taking more X-rays. The overall principle governing all of this is called ALARA, as low as reasonably achievable. It means the team is professionally committed to using the minimum amount of radiation necessary to get a diagnostically useful result. Not as a goal, as a standard. Let's walk through what a fluoroscopy visit actually looks like. Before you arrive, your care team will send you preparation instructions. These vary depending on your specific procedure. Some procedures require no preparation at all. Others may ask you to avoid eating or drinking for a period of time, follow a special diet, or complete a bowel preparation. Some, like a procedure called HSG, which evaluates the fallopian tubes, are scheduled at a specific point in your menstrual cycle. Read your preparation instructions carefully, follow them completely, and call the imaging department if you have any questions before the day of your procedure. On the day of the exam, plan to arrive a few minutes early. You'll check in at the radiology department or procedure suite. A technologist will review your history with you, confirm your preparation, and answer any questions before you get started. Before any fluoroscopy procedure, there are a few things the imaging team always needs to know. First, pregnancy or possible pregnancy. This is the most important disclosure. X-ray and the developing fetus require careful consideration. The team cannot safely proceed without this information. Second, any prior reactions to contrast agents or known allergies. For procedures using iodinated contrast, this history is essential. Third, kidney function, if iodinated contrast will be used. Certain kidney conditions require adjustment of the contrast protocol or alternative approaches. Fourth, your current medications, particularly blood thinners, diabetes medications such as metformin, and any medications you take that affect your blood or your kidneys. And finally, any prior surgeries or significant medical conditions involving the area being examined. None of these questions are meant to create barriers to your care. They're the team's way of making your procedure as safe and effective as possible. When you enter the fluoroscopy room, you'll see the imaging equipment, the C-arm, or the fluoroscopy tower and table. It may look large and somewhat mechanical. That's completely normal. The technologist will explain everything before it happens. They'll position you on the table, which may be tilted or repositioned during the exam to help move contrast or improve the image angle. They'll tell you before they move you. You may be asked to hold still, to breathe in a particular way, to swallow on command, or to hold your breath briefly. Following these instructions as closely as you can helps produce the best images. You may see the fluoroscopy monitor. What you see on it will depend entirely on your procedure. For a barium study, you might see the bright white outline of contrast moving through your digestive tract. For a spinal injection, you might see the bony outlines of your spine and the needle. The technologist can explain what you're seeing if you'd like. Fluoroscopy is not one procedure. It's a platform for many different procedures, each with its own purpose and experience. A modified barium swallow evaluates how you swallow, often performed alongside a speech-language pathologist when swallowing difficulty is a concern. An upper GI series or esophagram uses barium to evaluate the esophagus, stomach, and sometimes the upper small intestine. A small bowel follow-through traces barium as it travels through the entire small intestine, a process that can take some time. A barium enema evaluates the large intestine using contrast introduced through the rectum. An arthrogram involves injecting contrast into a joint, often followed by MRI for detailed soft tissue evaluation. An HSG, hysterosalpingography, evaluates the uterine cavity and fallopian tubes for openness and anatomy. Fluoroscopy also guides spinal procedures, including lumbar puncture and epidural steroid injections, allowing the physician to see exactly where the needle is as they work. And there are many additional urologic and GI procedures where fluoroscopy provides real-time guidance. Your specific procedure may look different from what you've seen here. The imaging team will walk you through exactly what your exam involves. After most diagnostic fluoroscopy procedures, you'll simply get dressed and go home. There's no recovery period from the imaging itself. If your procedure involved a contrast injection or a guidance procedure, the team may observe you briefly before discharge and will give you specific instructions to follow at home. Some fluoroscopy procedures use a contrast agent, a substance that absorbs X-ray energy and makes hollow structures visible on the monitor that would otherwise be hard to see. For GI procedures, anything involving the digestive tract, the contrast agent is usually barium sulfate. You may need to swallow it, or in some procedures, have it introduced in other ways. Barium sulfate is a white, chalky compound. It is not absorbed by the body. It travels through your digestive tract and is eliminated in the stool, which may appear pale or whitish for a day or two afterward. That's completely expected. In terms of taste, barium suspensions are typically chalky, with a texture that ranges from thin and drinkable to thicker depending on the exam. Most preparations are flavored. Strawberry, vanilla, and banana are common, which makes them more palatable. Patients often tell us it tastes like a somewhat thick, medicinal milkshake. Not everyone loves it, but most people manage it without difficulty. Drink plenty of water or other fluids after a barium procedure, as the imaging team recommends, to help the barium move through your system. For procedures involving joints, the spine, the uterus and fallopian tubes, or certain urologic studies, a different type of contrast is used: iodinated contrast. This is water-soluble, meaning the body can absorb and eliminate it naturally. When iodinated contrast is injected, you may feel a brief sensation of warmth or a temporary metallic taste. This is normal and fades quickly. Before any procedure using iodinated contrast, the team will ask about your allergy history and prior contrast reactions, your kidney function, and your medications. This is how the team protects you, not a formality. If you have ever had a reaction to contrast dye in the past, or if you have significant kidney disease or are taking certain diabetes medications, tell the team before your procedure. That information allows them to make the safest choices for you. Myth: the radiation stays in my body after fluoroscopy.
Fact: X-ray energy is a form of electromagnetic radiation, similar to light. When the X-ray beam is turned off, there is nothing left inside your body. No radiation is deposited, no energy lingers. This is different from nuclear medicine procedures, where a small amount of radioactive material is actually introduced into the body. Fluoroscopy uses an external X-ray beam that passes through and moves on.
Myth: the imaging staff leave the room because the radiation is going to be really dangerous.
Fact: staff leave or shield themselves because they perform multiple procedures every day, and managing their cumulative occupational exposure is a standard professional practice. For you, this is one procedure. The staff's precautions reflect routine radiation safety, not an indication of unusual risk to the patient.
Myth: barium is a dangerous chemical.
Fact: barium sulfate, the compound used in GI fluoroscopy, is chemically inert and not absorbed by the body. It has a well-established safety record. The body doesn't process it, it simply moves through and exits. The imaging team confirms it's appropriate for each patient before use.
Myth: fluoroscopy and CT are basically the same thing.
Fact: both use X-ray energy, but they work differently and serve different purposes. Fluoroscopy produces a real-time, two-dimensional moving image and is used for motion studies, contrast flow, and guidance procedures. CT acquires cross-sectional data and produces detailed, three-dimensional anatomical images. They are distinct tools for different clinical questions.
Let's revisit safety, because it deserves a full explanation, not a summary. ALARA, as low as reasonably achievable, is not just a phrase. It's an active, ongoing practice that every trained radiologic technologist and radiologist applies throughout every fluoroscopy procedure. Pulsed fluoroscopy reduces the total time the beam is on by using short bursts rather than a continuous beam. Last image hold captures and holds the most recent image on the monitor so the team can review it without the beam being active. Collimation narrows the beam to cover only the area of clinical interest, reducing exposure to surrounding tissue. Staff wear lead aprons, thyroid collars, and leaded glasses when they need to remain in the room. These are standard personal protective equipment for fluoroscopy environments. The imaging team's goal is to answer your doctor's clinical question using the minimum radiation that gets the job done. That is professional practice, not a marketing message. Your care team and ordering physician have already weighed the benefit of the information fluoroscopy will provide against the radiation involved. If they determined fluoroscopy was the right choice, it's because the clinical benefit warranted it for your specific situation. Fluoroscopy has genuine advantages that no other imaging modality can replicate. It provides a live, real-time image, which is essential when motion, function, or guided placement is the clinical question. No other standard imaging modality can show a swallow as it happens, trace contrast flowing through the bowel in real time, or guide a needle to a precise anatomical location with live visual confirmation. It is fast, available in many settings including operating rooms and procedure suites, and can provide immediate information that guides the clinical decision in the room at that moment. At the same time, fluoroscopy has limitations. It does not provide the detailed three-dimensional cross-sectional anatomy that CT offers. It does not show the soft tissue contrast of MRI. It does not provide the real-time flow information of vascular ultrasound. For questions that require those capabilities, your physician would choose a different modality. Fluoroscopy is the right tool for the specific clinical question it was designed to answer. That is why your physician ordered it for you. Here are a few practical things to keep in mind before your fluoroscopy procedure. 1. Read your preparation instructions carefully and follow them completely. They are specific to your procedure. If you have questions, call the imaging department before the day of your exam. 2. Let the scheduling team know in advance about any significant medical conditions, allergies, prior contrast reactions, or concerns about anxiety or mobility. The earlier they know, the better they can prepare for you. 3. Ask questions before the day of the procedure, not while you're on the table. The imaging team is happy to answer questions when there's time to have a real conversation. 4. Wear comfortable, easy-to-change clothing. You may be asked to change into a gown. Leave jewelry and metal items at home or in your car. 5. If your procedure involves barium, plan to increase your fluid intake for the rest of the day afterward, as the imaging team instructs, to help move the barium through your system. 6. If your procedure involves an injection, an arthrogram, an HSG, or a spinal injection, arrange transportation if the team advises it. Ask in advance whether you should plan for rest afterward. 7. If anxiety is significant, mention it during scheduling. The team wants to know, and in some cases, accommodations can be made. You've just gone further to understand fluoroscopy than most patients ever do before their exam. That matters. Here is what we want you to remember. Fluoroscopy is a live, moving X-ray, the right tool when your physician needs to see motion, flow, or real-time guidance. The imaging team is trained in its safe use, and ALARA, using the minimum radiation needed, is a professional commitment they make to every patient, every time. Barium is not dangerous. Contrast agents are chosen carefully for each patient. The procedures are monitored throughout. The radiologist reviews your images and provides a report for your physician. If you have questions, ask them. The imaging team would rather you ask every question you have than arrive uncertain and anxious. If someone you know has been scheduled for a fluoroscopy procedure, share this video with them. And whenever you need clear, evidence-based answers to medical imaging questions, Rad Veritas is here. Truth, integrity, accountability, precision, excellence. radveritas.com